Vitamin D has long been hailed as a crucial nutrient for bone health, immune function, and overall well-being. For many, the recommendation to take vitamin D supplements, especially during the winter months or for those who have limited sun exposure, seems like a simple and effective way to maintain health. However, recent discussions about the potential dangers of excessive vitamin D intake call for caution and a more nuanced understanding of its effects. While vitamin D deficiency is undoubtedly a concern, particularly in regions with limited sunlight or among older populations, the idea that higher doses of vitamin D are universally beneficial is misleading. Overdosing on vitamin D can lead to toxicity, a condition known as hypervitaminosis D, which can have serious health implications. Despite the common belief that more of this nutrient will only lead to positive outcomes, research shows that excessive amounts can result in elevated levels of calcium in the blood, causing symptoms like nausea, vomiting, weakness, and in severe cases, kidney damage. This is not a rare occurrence. It can affect those who take excessive doses of supplements without proper medical guidance or understanding of the risks. The recent study that has been making waves, which challenges the idea that vitamin D overdosing is harmless, underscores an important reality. The risks associated with taking too much vitamin D are not always immediately obvious. Many individuals, assuming they're simply doing good by taking daily supplements, may not realize that they are putting themselves at risk of long-term complications. This can be especially concerning because the effects of hypervitaminosis D are often gradual and may only manifest once significant damage has occurred. Kidney stones, for example, are a common and painful result of prolonged vitamin D toxicity, and the long-term strain on the kidneys can lead to chronic health issues that are not easily reversed. What's more troubling is the growing trend of self-prescribing and overuse of vitamin D supplements, particularly among people who are not under the care of a healthcare professional. Many consumers are guided by broad health advice rather than personalized medical recommendations. Without proper oversight, the lines between necessary supplementation and harmful overconsumption can become blurred. It's easy to believe that taking a pill is a quick and simple fix to avoid health problems, but the risks of such unchecked use are significant. Individuals who are unaware of their own vitamin D levels or unaware of how much they actually need are particularly vulnerable to the potential dangers of excess. Despite the positive rhetoric surrounding vitamin D supplementation, it's important to recognize that moderation is key. Like most nutrients, the body only requires a certain amount to function optimally, and taking more than necessary can actually lead to adverse health consequences. This is especially true when there is no clinical indication that higher doses are needed. Rather than blindly following general advice or jumping on the bandwagon of vitamin D supplementation, individuals should consult with healthcare providers to assess their own needs. Blood tests can help determine whether supplementation is required and, if so, at what level. The increasing accessibility of vitamin D supplements, combined with misinformation or oversimplified health advice, leads many people to believe that larger doses are always better. This more is better mentality is dangerous, especially when it comes to fat-soluble vitamins like vitamin D, which are stored in the body and can accumulate to harmful levels. There's no one-size-fits-all approach to supplementation, and what works for one person may not be suitable for another. In conclusion, while vitamin D is undoubtedly important for health, it's essential to approach supplementation with caution. The potential risks associated with overdosing on vitamin D are real and should not be underestimated. Before deciding to take vitamin D supplements, individuals should first seek medical advice to ensure they are meeting their specific health needs in a safe and effective manner. Only with a balanced and informed approach can the true benefits of vitamin D be realized without putting one's health at unnecessary risk.